Hi, my name is Adrienne, and today we are going to look at the relationship between psychosis and social functioning in individuals diagnosed with schizophrenia. We are also going to consider why the therapeutic alliance of person-centered therapy can serve as an appropriate treatment modality for this population. Psychosis is a state of distorted or impaired thought, feeling, and behavior leading to a loss of contact with reality and presents as either delusional beliefs or perception-like hallucinations. Psychosis is a symptom of schizophrenia spectrum and other psychotic disorders. Today, I will mostly focus on schizophrenia as it is the most common occurring psychotic disorder. Development of psychotic symptoms can depend on genetic vulnerability and exposure to environmental or psychosocial stressors. Psychotic symptoms present as delusions, which are fixed beliefs deemed bizarre if clearly implausible to same culture peers and do not derive from ordinary life experiences. Some examples include persecutory delusions, grandiose delusions, or delusions of control. Hallucinations, on the other hand, are vivid and clear perception-like experiences that occur without external stimulus. These can occur on any of the five senses, but the most common being auditory hallucination. I would like to highlight that schizophrenia is a complex and long-term illness in which active psychotic symptoms wax and wane throughout the lifespan with the help of consistent treatment. Schizophrenia is characterized by psychotic symptoms, cognitive impairment, grossly disorganized behavior, and negative symptoms. These symptoms greatly impact the daily functioning and social worlds of individuals diagnosed with schizophrenia. The average age of onset for men is in early 20s and for women in late 20s. Reduction of symptoms and improvement in quality of life is most definitely possible through consistent treatment, which can include the use of psychotropic medications, engagement in individual or group counseling, and community support services, to name a few. As mentioned, schizophrenia is characterized by psychotic symptoms and cognitive impairments. Deficits in attention, working memory, and executive functioning can make taking in and navigating the world challenging for people diagnosed with schizophrenia. Psychosis and cognitive impairment directly impact social and occupational functioning. People with schizophrenia may find relating to others confusing because of impaired ability to interpret emotion and theory of mind. People with schizophrenia are also likely to develop paranoia and socially withdraw from the community. People with schizophrenia experience social exclusion at a much higher rate than the rest of the population, which can lead to decreased psychological security and further impairment in cognitive functioning. Interventions focused on social support and integration may benefit daily functioning by reducing cognitive impairments and psychological stress. On this note, let's now take a look at person-centered therapy for the treatment of schizophrenia, focusing on how the therapeutic relationship can serve to build the client's sense of self and social connection with others. Carl Rogers is the father of person-centered therapy, a treatment modality that believes at its core, therapy is a relationship formed between two people for the purpose of change. This therapeutic relationship is rooted in three core conditions, which are unconditional positive regard or acceptance for the client, congruence or genuineness from the therapist, and accurate empathy for and understanding of the client's experience. The person-centered therapist also holds the attitude or belief that all people possess an innate tendency for growth and self-actualization no matter what. This attitude is deeply important to the bond formed between client and therapist and the outcome of therapy. Through the client's perspective, we have learned that how people process psychosis may influence their quality of life more than the experience of psychosis itself. People with psychosis indicated they experienced a turning point when they encountered a helping professional who took genuine interest in them and treating them as a person, not a patient, communicated acceptance of their experience of psychosis, discussed voice hearing in normal language as part of normal experience, conveyed messages of hope and optimism, and promoted positive sense of identity and empowerment. From the person-centered therapist's perspective, we have learned what is considered helpful and how clients who experience psychosis can benefit from the therapeutic relationship. Helpful factors include building a person-centered relationship, promoting unconditional positive regard and empathy, working with psychotic content through the acceptance of client's reality, and not seeing a client as a label or illness. Perceived client benefits include improved social skills and relationships, more connected and socially oriented, decreased difficulties with delusions and hallucinations, and improvements in sense of self and overall quality of life. A potential way to assess client growth may be having them complete the general belongingness scale at the beginning, middle, and end of treatment. This can provide helpful insight to both therapist and client regarding the client's general feelings of acceptance and inclusion and rejection and exclusion. In my own experience working with individuals with schizophrenia and psychosis-related disorders, I have witnessed the power of therapeutic relationship in the lives of those who are often isolated and withdrawn. As a final thought, I would like to leave you with this quote from Rogers, who said, "The task of psychotherapy is to help the person achieve, through a special relationship with a therapist, good communication within himself. Once this is achieved, he can communicate more freely and more effectively with others."